Hello.
Hey, how are you?
I am doing really well. How about yourself?
Pretty good, pretty good. I've been getting into a schedule again of like napping when I get home so I can get some sleep.
I bet you need those naps.
Yeah, I mean, I think what time did I tune into your stream last night? Like what, 2 a.m. or something?
Yeah,
Or
something
1 a.m.?
ridiculous. Yeah.
Yeah, I get like 3 hours of sleep a day. I'm working on it.
How can you function like that? Just like I need like 9 or I'm non-functional like for an entire day.
I think for me it's just used to having a lot of caffeine in my system.
I gotcha.
And like to function at work I take caffeine pills and drink coffee, so
Holy moly. How
yeah,
like
I'm like wired all the time.
as a doctor is that sustainable?
No, but unfortunately it's all I can do right now.
Yeah.
I have very what's so amazing, and how would you like to be referred to, as Jack,
Oh yeah,
Riverboat Jack,
you
or
you can call me Jack. Jack is my actual name. So,
oh, okay, got it.
yeah.
um but yeah, what's been amazing, Jack, is since I've been on Twitch in November, I've been spending like every single day being a doomer, and this is the first week I have like positive things to say. So you're lucky. You're lucky
Awesome.
you're having me on when I have positive things to finally say.
Well, I mean, I don't really blame you for being doomer. Like, I mean, I can't imagine like so just so viewers know, you're
Mhm.
a doctor who works on like the front line of COVID-19.
Yeah, so I'll do my little intro
Yeah.
thing, and then after I do it, you want to do yours for my community as
Sure.
well.
Yeah.
Um, so I'm Doc Midnight. I've been on Twitch since the beginning of November. I've been working as an intern in anesthesiology and critical care since March, and my life has been COVID. I have also, while working on COVID patients between 80 to 100 hours a week, have also involved myself in the coronavirus research task force of the hospital that I'm a part of. I've also played a part in the writing of the Jon Snow memorandum as well.
What is that?
Oh, I'd love to talk about that.
Please do.
Yeah, we can talk about that after my.
How does Game of
Uh,
Thrones connect into all this?
so not Game of Thrones. I wish it was Game of Thrones. Actually, maybe actually Game of Thrones might connect into this, but
Really? Okay.
yeah, so I'm on Twitch basically. Initially I was on Twitch to sort of inform the public about unethical things going on due to the governmental political influence on medical healthcare systems and COVID. But I'm going to stay on Twitch even after the virus is over to try to be sort of, you know the pioneer of actively bridging the gap between science and medicine and public knowledge and trust.
Hmm.
That's what I'm going to be focusing my channel on afterwards.
Okay.
And yeah, you want to do your.
Sure. Yeah. Hello, everybody. My name is Jack. I go by Riverboat Jack on Twitch. I worked as like a video game journalist for like a decade, doing podcasts and D&D stuff and all the good nerdy things. And this year kind of broke me. And basically, I was just like, fuck it. I'm gonna go on Twitch and I'm going to advocate for my political beliefs and try and make the world a better place because
Mhm,
I am able. One of the few things I'm able to do very well is talk, and
mhm,
so I'm a socialist. I advocate for socialist policies like Medicare for all and like decommodifying housing
mhm.
and transitioning us to like a society of worker co-ops to more equitably distribute wealth. Um,
Awesome.
yeah, these are the things I advocate for in a nutshell. And if you're ever interested in coming by my channel to learn more about that, that's basically what I talk about all the time, along with political news and taking down reactionaries and all that good stuff.
We're I would like to announce that we're chair buddies, by the way.
Really?
Except, yeah, I have the Game of Thrones Lannister version.
Oh, okay. So maybe I wasn't too far off with
Nope.
the medical fan fiction that you're writing over there with the Jon Snow memorandum.
No. So basically, and I'd like to like share that why I'm on Twitch too is like one day I was just fed up as well.
Hmm.
I was just like, I've tried to do local outreach, nothing is changing, nothing is being done. The public deserves to know, as consumers of a for-profit system, how to best make their decisions as a consumer. So they need to know what's going on behind the scenes.
Hmm.
And I was just like, the world needs to know. I don't care anymore. Like I'm tired of feeling like this every single day I come home from work. And that's how I started my Twitch channel too.
So why doesn't the world know about this?
Uh, because a good portion of what I used to talk about when I was initially on Twitch in terms of scandals and sort of dodgy things going on were things that were a result of directly a result of the actions of our federal government.
Okay.
And even now a certain amount of those things are still going on. Because I think people need to realize we still have our former administration
What is it?
until January.
Oh, yeah, yeah. Okay. I thought for a second I was like, the Obama administration? They're still around somehow? The ghost of Obama?
Well, some people like to think so, right?
Yeah, just another way of saying the deep state, right?
Yeah, yeah. But what I used to cover ranged from things such as like, uh, we were using one set of PPE for like 5, 6 months straight, even though, you know, Donald Trump was like, "Hey, we've sent so much PPE to hospitals, blah blah blah," and we didn't get anything.
You
Um,
didn't get anything?
no,
Wow.
not from the federal government. No. Actually, this has been confirmed because recently someone I know who was in the military found a warehouse that they work at full of like I think 500,000 N95s or like 300,000 N95s just sitting there collecting dust since March.
How? How does that happen?
I'm not going to name this person, but
Yeah,
obviously, but
no
yeah,
worries.
yeah, and even private donations were either thrown out or also just sequestered and collecting dust.
But what
Um,
like why does that happen? Why doesn't it go to the hospitals that need it? Is it incompetence? Is it like negligence? Is it like
all of that.
just fuck people?
Yeah, and like I said, the PP that were received by our hospital were directed by our administration to throw out like 95% of it on the basis of like, oh well, they could have poked a hole in it, they could have like damaged it in some way. Whereas we were working on like already damaged and like thin and wearing out PPE for 6 months anyway.
When you say you were using PPE for 6 months, are we talking like top of the line gear, like best in the world? Our for profit healthcare system.
No, we're just talking about simple face shields, goggles, N95s, gowns. The only things we were able to change often were gloves.
I'm still
But these gowns are meant to be disposable. The ones
yeah.
we were using for 6 months.
So
Um,
like, what is the justification when you go like, hey, we need more of this stuff? Why aren't we getting it? Like when you go to the hospital administration, like, is it just the hospital doesn't have the money? And then when the hospital talks to the government's just like, no.
uh, the hospital definitely has the money to just buy it themselves anyway. But they have went, many hospitals around the nation have went the route of asking for aid from the federal government.
Hmm.
Uh, and for the most part, none of that came, and they ended up asking for 10 months straight, and some still are.
But then the hospital, why didn't the hospital like in the meantime buy the PPE?
because they want to spend as little of their own money as possible.
But isn't this leading to like the deaths of people who are like working to save lives? Isn't this impacting
Yeah,
like hospital functionality?
yeah, but the administration sees it as saving money.
Would it what would fix this? Like what where is the breakdown, I guess? Is it like at all levels? What would if you were in charge?
It's at all levels. The whole entire pharmaceutical industry insurance system needs to be shut down and start restarted from ground up and incorporated into our government for like healthcare for all.
Mhm.
Private hospitals shouldn't exist anymore.
Yeah,
Um, yeah.
and that like your argument for this is basically that like these hospitals that are working for profit are essentially letting their workers get sick and die and like become overworked and
Yeah, I mean, in July, something I used to talk about a lot was that they in July, our hospital and hospitals around the nation all of a sudden stopped temperature checking and symptom checking every worker that went into the hospital, and
why?
they created an app to allow workers self-report their symptoms. And of course, people are afraid for their jobs, so they're going to self-report that they don't have COVID, even though they have COVID symptoms. And that increased the volume of patients we were able to see dramatically,
Yeah,
which is why they did that. You know,
but doesn't that then mean that like the workers are infecting the patients if they don't have COVID?
outside of the ICU, yeah, no, it does. And because my hospital administration was more had more right wing representatives in the administration, there were things that were going on where like it was masks optional once doors were closed for patients. Like if the patient didn't want to wear a mask while being seen in the clinic, and this is outside of the ICU, just other specialties.
Mm-hmm.
Um, the doctors couldn't say anything. They couldn't make the patient wear the mask. You
Um,
know,
can
like
can you say what region of the country you work in?
unfortunately, no. And I hope you
Okay,
understand. It's because
absolutely.
I talk about all of this stuff.
Yeah.
Um, like in just politically, like all of them were in favor with the administration. People have been working from home since March
Mm-hmm.
and finding reasons to work from home and not see patients as well. While while they're throwing us like on the front lines,
So
because we're junior members.
I guess like how when these tangible effects start hitting hospitals and like it gets up to like the board of directors like oh we like our workers have started dying, does that move them at all to like spend money, or
Uh,
it does it really come down to like conservative members don't think it's an issue
they
or
don't think it's an issue. I mean, the CEO of my own hospital has outwardly spoken out against wearing masks.
how like how like wait how how does that happen? You're in charge of a hospital, like they should be up on all the science. Why?
It's the problem that the more often than not, hospital administrations, people that work in the administration side,
Mm-hmm.
come straight from business school. They've never been in the clinic. They've never seen patients. They have zero clinical or scientific background. They just learned in business school how to run a hospital.
So do they
Uh,
think that like you're like the actual medical workers are like whiny babies
yeah,
about this?
basically. I mean, a couple of weeks ago, I was complaining to my community about this. Uh, they held a pizza party just to tell us that as a board, they've determined that none of us are getting hazard pay this year.
What the fuck? What the fuck? 300,000 people have died. What? We've been having a 9/11's worth of people dying every day for like the last week or something. What? They're fucking throwing a pizza party for you?
Yeah, to tell us we're not getting hazard pay.
That's insane. I'm starting to understand why you've been doomering.
Yeah.
Um, I, so like is like the only solution to this really like abolishing private hospitals, private insurance companies, like
Definitively.
yeah,
Everything just needs to get TNT'd and built back.
yeah,
I mean, at the very least, the best small change that should happen is people at the highest levels of hospital administration should have a requirement to have clinical experience or some form of clinical experience.
yeah, or at least like some medical background,
You know,
like
they shouldn't be some uh like spoon fed silver spoon fed person from Harvard Business School who's like 20 something and just came out of getting his MBA and now is like in the highest level of power at a hospital system, right?
yeah. So like what are some of your experiences in the hospital on like a day-to-day basis to kind of give people like an idea?
um and also I'm going to say that, and after that, since so that we don't forget, I'm going to talk about the Jon Snow thing.
Yes. Yes.
Otherwise I feel like we're going to forget it.
Yeah.
I mean, unfortunately, even though I have good news this week for my community, uh, my work life has not changed at all. This week, two of my like colleagues have died in the ICU after getting COVID from working in the ICU. Um, you know, it's just like a wasteland of like, it's almost like a eerie, calm silence in the ICU because all the patients are sedated, and you basically just sit there and wait for patients needing emergency mechanical intubation, you know.
That's
or
that's
you
really like scary.
Yeah, or you just wait for patients either to die so that more beds open up, or you wait for patients, you know, to survive. But some of the patients that have survived a month later have now come back to the ICU from reinfection.
How common is reinfection? Like at the beginning we were hearing like very different like rates of reinfection
Well,
or
yeah, it's
yeah.
because reinfection right now is so anecdotal, and it still is because research is still being done.
Hmm.
I mean, I can say for a fact that where I am, uh, the past month or two at least, 15 to 20 people, I think, that I've seen previously have come back reinfected. And of those 15 to 20, three of them have died from reinfection.
Hmm.
But
Wow.
that's my anecdotal, you know,
Yeah.
I, you know, I think once since the data is still being collected, I think we'll have a better idea, like nationally, maybe in a month or two.
Just real quick before you get into the Jon Snow stuff,
Yeah,
have you yourself gotten COVID?
I had a scare actually on Monday.
Ugh.
Yeah, where I basically like got up to go to work, and I realized like I had like immense body fatigue and brain fog, and I like it took me like 20 minutes to drag myself to my desk that is like 1 foot away from my bed. And I was like, oh shoot, I have COVID. There's no other thing that I can possibly have. Like, you know, and luckily, like because of mistreatment from the administration, a good portion of people I work with, especially the other residents, sort of have a like we're all in this together mentality.
Hmm.
So I was able to get people to cover me while I called out of work and went to get a COVID test. Um, but even then, like I was simply just informed by my administration I need to get a COVID test ASAP, and if it's negative, as soon as it becomes negative, I need to report back to work. So then Tuesday, Wednesday, and Thursday, and today, I've been at work with like immense brain fog. Today at work, I've seen like hallucinations, and I
Uh, um, do you have COVID or are you like is this
no, I
like just
don't. I don't.
stress?
Oh, sorry. So yeah, on Tuesday morning, uh, because the tests for healthcare workers come back faster. On Tuesday morning, I was negative, so I went straight to work. Um, yeah, you know, it's like a combination of like seeing the same thing every day to like lack of sleep. I'm sure I'm not helping my lack of sleep by like streaming so much as well, but I feel like I have like an obligation to not only to like the public but to myself.
Yeah.
Um, I think, and a lot of the hallucinations have to do with my PTSD. And at some point, all the bodies sort of start looking the same, and then you start to hallucinate sometimes the faces of like other people, and yeah, it's like today I was hallucinating that I was hearing one of my patients that have died 1 or 2 months ago singing, like as if it was like a ghost story type of thing.
That's
Uh,
I don't even know what to say to that. Like I'm so fucking sorry that things have gotten this bad.
yeah,
And
so I just took more caffeine pills and went on my way, and that got rid of it. That's how we've been working these past. You know,
yeah.
I'm sure my story is echoed by a lot of people nationwide.
Yeah, so is it surprising to you when like doctors like there have been some reports of like an uptick in like doctor suicides? Is that surprising to
No,
you?
no. I mean, since March, about 5 to 6 of people I work with in a 60-person staffed 60-person ICU have committed suicide. Colleagues that I have around the nation have committed suicide. Actually, late last night, another colleague I went to a medical school with did it. Like this is happening too, like nationwide since March, and no one has been talking about it except me.
That's
Right?
that's
Like,
that's wild. Like 8% of the people you worked with in your hospital in like this situation have committed suicide. That that's insane.
yeah, because they're for the most part, right? They're trying to do what they're supposed to be doing. So a lot of them, like me, I haven't seen my fiance since March. I haven't seen my parents, my
Mhm.
siblings, anyone since March. And understandably so, that takes a toll. That's part of the reason why a lot of people are getting sick of the lockdowns, because they're not seeing their family members, in addition to not receiving money from the federal government.
Yeah.
um
And in
like,
addition to not even fucking receiving hazard pay.
yeah.
Um it do you, I know I keep asking questions and I'm sorry. Do you guys have like any kind of union representation at all?
Oh, this is the funny part.
Oh no. I get the feeling it's not going to be funny.
So when we sign our contracts to the hospital, there's like a legal clause that basically implies that if we even talk to union representatives, we can say goodbye to our jobs at this particular hospital.
Is that even fucking legal?
No, but they found loopholes. Uh, Like, as long as laws have been made, there's always been other lawyers being hired to find loopholes for them.
True.
Like,
So there's like nothing protecting you from like the hospital administration that's
yeah, it's like
essentially
there's
forcing you
yeah,
to work.
yeah, there's unions, there's doctor and nurses, whatever unions around the nation, but it doesn't mean anything if we can't utilize it.
Right.
You know.
So what is the Jon Snow memo?
Oh, okay. So a while ago, uh, in Massachusetts, a group of right wing scientists and doctors wrote this thing called the Great Barrington Declaration. If you
I
heard of that,
I've gone over that. It sounds like it was signed by a bunch of whack jobs and trolls.
so yes, but the thing is that like they were able to garner so much support because they are scientists and doctors, so they know how to phrase what they were trying to say logically
Hmm.
in a way that appealed to the logic and sense of actual other reasonable scientists and doctors, and then swung them to their side. Right?
Okay.
So like one of the more logical things to a like scientist, they said, was like, okay, well, I know we know it's crazy to completely remove lockdowns, so we're going to sequester all the people at risk around the whole nation into like separate living facilities, and that'll protect them, and that'll allow us to continue with removing lockdowns around the nation.
That's fucking crazy, but okay.
But like to a scientist, right? All of a sudden, right? That sort of briefly starts appealing to their sense of like medical and scientific logic, right?
Hmm.
And then when they say more things like bringing out statistics, mental health statistics of people committing suicide during lockdown, and statistics of surveys of people's depression and suicidal ideation during lockdown that are rising exponentially, and then conveniently don't mention the fact that this is the case because we have no federal support for businesses and for the people.
Yeah.
um how the problem is a lot of reasonable scientists and doctors, right, who were sort of undecided. A lot of scientists and doctors, like, I am going to say this, right, grew up in privileged environments.
Hmm.
Not all of them, but a lot of them. So like when they go through school and finish, one of the things they don't really think about is the fact that like there are people that are struggling every day, paycheck to paycheck.
Yeah.
Yeah,
That's something I have to talk about on this channel all the time.
yeah,
Most people pre-pandemic didn't have $400 for unexpected expenses. So like
yeah. I mean,
literally anything would like wipe them out.
yeah, and that's for like I would say a good 70%, 80% of people, right?
Hmm.
The 1,200 we got for 10 months went straight to rent.
Yep.
Um, but the people who wrote this declaration know for a fact that a lot of these highly educated people don't really understand that. I mean, to be quite frank, uh, and I'm really sad to admit this, but I need to admit it. Um, before I started working in a free clinic during medical school, I didn't even know the extent of the struggle that most of the American population goes through.
Hmm.
And I grew up really extremely poor. Like my mom relied on like free school lunches and churches and like free school lunches on like the weekends to feed us.
Hmm.
But we did, when I was like eight or nine, we did end up coming into a lot of money. So then like that's not how I grew up anymore after the age of 8. Um, so like that sort of background I have, like most people highly educated don't have never even had a period of growing up extremely poor.
Hmm.
So of course the people who wrote this declaration know that, right? So like if you're putting yourself in the shoes of someone with that background, Jack, right,
Right.
then doesn't it sound reasonable to not think about, like, when they're bringing up these mental health statistics, right, then it sounds reasonable to not think about the fact that it's because people are struggling to survive, right? When they
Right.
conveniently don't mention it, right?
Right. That it comes down to, oh, it's the isolation. It's
Exactly.
yeah,
Hmm.
rather than like the literally not having the money to live.
Yeah, but I think that's part of what I'm trying to do here on Twitch in terms of bridging the gap. It's not just bridging the gap of like scientific and medical knowledge to the general public. It's also bridging the gap of the lack of knowledge in healthcare professionals to the plights and the situations of the general public.
Hmm.
It goes both ways. Um, and this is extreme evidence of that. Like the Barrington Declaration has like tens of thousands of signatures. Some of the people who have signed it are people I know that I have seen as reasonable people. They have no idea what they're doing because the people who created it are so clever
Hmm.
in terms of like how they're phrasing what they're trying to say.
Yeah.
Um, so what ended up happening was, as soon as this started picking up, uh, I started hearing buzz around the world, basically, of a group of scientists and doctors wanting to write like a counter paper or like a counter declaration to this. And I was basically like, I like contacted everyone I could, right? Just like I do on Twitch. And I
Hmm.
was basically like, sign me up. Like, I want to take a part in this. Um, and what we ended up writing it was a good couple hundred of us that started writing this all together around the nation. Uh, if you want to look it up and show it to your stream,
Yeah.
uh, the the Jon Snow memorandum.
Okay.
And
Okay. It's and
yeah,
it's not spelled the same as the Game of Thrones character.
no. But I'm
Okay.
gonna talk about why actually now that I think about it. Game of Thrones character also applies here. So who it's actually named after is this physician in the late 1800s
Hmm.
named Jon Snow, who basically has been credited through history for stopping the cholera outbreak,
Oh, yeah, yeah, yeah.
saving everyone from cholera, basically.
Hmm.
And when he initially started doing his own experiments and like realizing that cholera was spread by like tainted water that everyone was drinking and stuff, he had to go through like a good probably couple months to a year period of time where everyone is discrediting him, telling him he was crazy. There was no way, like you're a fucking idiot. Like people were asking for his license to be removed or whatever, until he like literally had to show it himself. Like he drank the water himself and gave himself cholera and then treated it to prove it to people.
That's that's absolutely wild. What a mad lad.
And that's sort of how we feel writing this declaration, right? That like people are saying actual scientists and doctors are counteracting against actual scientific reason. So we have to like, even though they're calling us crazy, we have to write something to defend ourselves with almost.
Hmm.
Why it's related to Game of Thrones, Jon Snow. I think, and my memory is hazy, but when Jon Snow was warning everyone about the White Walkers, weren't they calling him crazy?
Yeah, basically. Yeah. No,
Yeah.
no one believed them until the last season, which we won't talk about.
Oh yeah, that was horrible. that that's more disappointing even than having to work in the ICU
Oh
this far.
damn. That's the that is possibly the harshest condemnation of season 7 of Game of Thrones.
Yeah, yeah. But I guess then it does apply to the Game of Thrones Jon Snow too. Then, right?
Hmm.
And oh, it was just so frustrating because it took us like 3 to 4 months to get this together, hundreds of hours of work.
Hmm. How
Yeah.
so how effective has it been?
Well, we've also similarly had an equal tens of thousands of people sign this.
Right.
um, it's just stupid that this has to happen. And then now the Lancet came out with like a paper comparing the two. Um, you know, it just felt so stupid to write a paper saying the exact opposite thing of some other paper,
Right.
right? And like providing evidence for saying the exact opposite thing. And I
Hmm.
think it speaks to the fact that behind the scenes, a lot of people don't know that the scientific and medical community has been divided this whole time too,
Right.
similarly to how our country has been.
Like is so does like the Great Barrington like Declaration have any actual like merit to it? Because you do say like it is somewhat worded to be based on science to some extent, at least enough to be like persuasive to these people? Or is it mostly just like, well, we could do these things, but like the things that it's proposing we do are like,
Are impossible.
yeah, like quarantining all old people or like people with like pre-existing conditions or whatever.
Yeah, like what are you gonna do? Like yell in the street, "Hey, anyone over this age, please come with me and live in a governmental facility,"
Yeah,
right?
who in America is going to do that?
um, yeah, it's more so the latter, Jack.
Okay.
Like, but even if all of what they're saying was possible, we have never in history, and this has been one of our biggest arguments against them. We have never once in history been able to address a pandemic without a vaccine.
Hmm.
You know, even if it's like something rudimentary, right?
Hmm.
Like how in the Spanish influenza in the U.S. physicians were creating vaccines themselves. Even if it was something like rudimentary like that,
Hmm.
it was still required to be
Right.
able to deal with it.
Yeah. And
Yeah, we have not been able to ever have herd immunity throughout history without a vaccine ever.
what do you know, like, because I know a lot of people like are like, oh, the Black Death. Did they wind up creating like some sort of rudimentary vaccine for that, or was
No, it just ran out of people to kill,
okay? So
right?
like your option are, well, like, well, a third of America in the wood chipper, and then we'll be good.
The
Like,
black, like people, the fucking idiots bringing up the Black Death don't realize that the Black Death kills a third, if not more, of the whole entire continent's population.
hmm, yeah,
Right?
yeah,
It literally ran out of people. It literally natural selection itself out.
yeah.
You know,
Like, is that basically what herd immunity is in this case?
essentially, essentially, yes.
Um, and this
That's
is
essentially that is the principle behind it. That like enough people who get it end up getting long term immunity to it. That eventually like a good percentage of the whole entire population are immune to it, and then eventually the virus dies out, right? Because there's such a small population that it can infect, and then
right.
they'll become immune to it, so it won't be infectious anymore to everyone else.
But in order to get to that point with COVID-19, we'd basically have to just condemn 6 million plus people to death.
For the small, and we won't even probably get that for the small chance of herd immunity.
Right.
For the chance of herd immunity, we're gonna have to accept 5 to 6 million deaths.
And that's something that
Like,
I find just absolutely staggering when like I watch like Ben Shapiro types, or like you hear these experts coming on Fox News. They're like, yeah, we'll just open Florida up to herd immunity. It'll be great. It'll be fine. And but like what I hear them saying is essentially, yeah, I'm fine with 6 million people dying, so I'm not inconvenienced.
basically,
Is like as a doctor, is that basically correct?
yeah,
Okay.
yeah. Those people, right? Similarly to like the people I was describing as highly educated, right?
Hmm.
They have no understanding of of people having to struggle and like live paycheck to paycheck. A lot of them, especially now, right, don't even have a paycheck to rely on.
Right. Yeah.
I mean, to sort of confirm this, right, Jack? I just sent you a link I was reading while I was getting home on my way home from work. Uh, they've done some analysis on how a lot of cases started, and this like scientific nerd conference held by Biogen in February was confirmed to lead to 300,000 cases worldwide
That's
of a
wild.
170 person conference. Because they don't get it, right? They don't get that like they're the a predominant portion of the American population is low income or unemployed, right, or both. Or
How did this is like a conference of medical professionals, right?
yeah,
How did this lead to so many 300,000 people getting infected?
because
These people should know better, right?
I mean, yeah. Back in February, though, back in February, there were this. It was a small percentage of people like me that were saying we should treat this seriously in the medical field, and it was a much larger percentage, like 80% at that moment in time in February, saying like, "Oh, it'll run its course. It's not going to be a big deal." When we were warned by China, we were warned by the scientists in China and doctors in China, that a lot of them that I know and speak to, in December.
Yeah. So can you kind of put to rest this idea that like um and this is something I hear a lot from right-wing reactionaries on here. Are people like in when people say China, like this is a deliberate Chinese attack with
We
like,
didn't even get it from China.
yeah.
The,
So
the statistics have been done. 0 people in America got it from China. We got it from tourists and tourists into America and out of America from Italy and France.
so
Uh,
so in order for it to be like a Chinese attack on America, it would have had to like be based on like infecting Wuhan and then like eh, on the off chance that it spreads to tourists who go back to Italy and France and then who go to the United States, and then we have such a piss poor response to it that we just let it spread, essentially. If that was like accurate, which I don't think it is.
no, no, and like the most god awful stupidest thing I've heard that side of things say is like, oh, it was also manufactured in the lab. Uh, like, point me please to the scientist that has figured out a way to engineer a new coronavirus, because that person's a fucking genius, because we have not been able to figure that out.
And
It's like scientifically impossible.
why is that?
We so it's sort of like the whole thing about when you speak about religion, right?
Mm-hmm.
You can't. I mean, I don't mean to like, go into your religious beliefs,
It's
but
fine.
you can't create something out of nothing, right? We can modify existing viruses. We can adapt existing viruses for cancer treatments and things like that, and we have been for the past 50 plus years. We can't generate a new virus out of nowhere,
And that's
right?
essentially what COVID-19 is.
Yeah, like Jesus can't create like, what is it, water from wine or something? Like you can't
Yeah, or
you can't generate.
wine from water.
I don't fucking know
Yeah.
what. You can't generate some scientifically. You can't make something that isn't there in the first place.
Hmm.
We don't have those kinds of capabilities yet, especially with viruses. We we have no, even though we understand the genome of a lot of viruses, we have no idea how to just synthesize a virus out of nowhere.
Yeah.
I would love to know how we could do that. That would be fucking genius.
Yeah, I imagine if we had that capability, we could use that to like cure all kinds of things.
Everything.
Yeah.
Yeah. Oh yeah, that would be amazing. We would create a virus, right? That like, oh my god, that can like go into like that's inactivated, that can easily go into every single cell in our body to deliver any kind of mRNA or medications or whatever, right? Like,
Yeah.
yeah, I fucking wish.
Oh gosh. So what I guess like what what can people outside the hospital system do to like you help other hospital workers? Because like apparently when we donate stuff it just gets thrown away. So like what can people do?
uh, I mean, what I've been doing on Twitch is anything that gets donated or subbed to me. I've been buying PPE for people I work with, as well as for the homeless community.
Hmm.
Actually, I would love to, if you want to go into the impact on the homeless community.
Please do. I talk about homelessness quite
Yeah,
a bit.
because I wanted to get on with Amy C3 about it, but that hasn't like worked out at all. So I'd love to talk to you about it instead.
Hmm.
Um, but that's one side of things. But there's nothing really to financially do. We just all nationally need like emotional support. You know,
Yeah.
like,
Fuck.
we recognize that we're not part of the large part of the population that are struggling financially.
Hmm.
I mean, like, I'm basically making like, I mean, I'm making $50,000 a year, but when you boil it down to the hours, I'm basically being paid like $11-12 an hour.
That's fucking insane.
But even then I get by, right? So I wouldn't say it's money we need. I think it's just outreach, like, for mental health we need. um not only just like convincing people in the healthcare profession to get mental health treatment, but also like making it available. But even outside of that, right, just like telling people that in any of your personal lives that work as essential workers inside or outside of healthcare, right? Because a lot of retail workers are going through the same thing we are.
Mm-hmm.
And, just let them know that you're there for them and that you're open to talking to them at any point in time, and hearing what they have to say. I think that's really important.
Okay. Yeah. Oh man, I no wonder you're doomering
Yeah.
quite a bit. So how has this been affecting the homeless community?
Oh my God. Um, so since March, none of them have gotten, at least where I am, none of them have gotten any PPE. Any philanthropic sort of organizations that were like Meals on Wheels or things like that were taking care of a lot of homeless communities before.
Mm-hmm.
I know Meals on Wheels doesn't, but there's like a version where I am of a Meals on Wheels thing that does take care of homeless communities. But since March, a lot of those philanthropic nonprofits have been losing money too, and have been forced to shut down. Uh, I mean, where I am, even a lot of soup kitchens, right, have shut down, and
Is
food co-ops,
is that due to lack of funding, or is it just too dangerous for them to operate?
both.
Okay.
It's not to mention, I mean, outside of that fact, right, homeless populations have been basically decimated by this virus. And like, it's only now in December, right, through Twitch donations that I can buy PPE to disseminate throughout the homeless community. Like, that's how little, like, the the general people of America have gotten no aid from the government, but they've gotten zero, absolutely zero aid.
Yeah, I suppose
From
there's no way for them to even have received that like $1,200 check.
Yeah, yeah.
Um, how how
I mean, like, since you talk about this a lot
yeah.
on your stream, Jack, like, would you sort of concur that like this is nationwide sort of happening?
Oh yeah, like
Yeah,
like one of the biggest problems in the United States is we largely treat the homeless community as like invisible. Like, you know, people don't want to invest in housing for the homeless. People just want them gone. You know, like
yeah,
gotta break up those tent communities because of all the crime they
yeah.
bring in or the
Well,
decrease in
yeah.
property value.
Athena in my chat puts this very well. They said you can't stay home if you're unhoused.
Yeah, exactly. Like in a sense it makes you even more dependent on social interaction, right? Because you need to like interact with like other people to try and get money. You need to be able to like rely on other people in the homeless community to kind of help support you.
Mhm.
And so you're having way more like interactions face to face, and if you have no
Yeah,
PPE, then like you're just going to get COVID-19 and then you're double fucked. Like
yeah. I
um
mean, the sickest thing that I've seen, and not sick in terms of like it's disgusting, but sick in terms of like it like hurt me emotionally the most,
mhm.
was seeing someone throw away their disposable mask outside of their car, and then a homeless person comes by and picks it
Oh,
up and uses it, right? Because they don't have anything.
right. Yeah.
Our hospital that got rid of all the PPE donated on the suspicion that it was tampered with for things like that.
Mhm.
That was like, it was not just thrown away; it was destroyed. So
Really?
yeah,
Yeah, someone in my chat, Mr. Stew69 says, "I'm at Feeding America in Florida and we've delivered 150% more than last year.
yeah,
But our donations are way down. The lines of cars grows each week, and there's no end in sight. And those are for
yeah,
people who like are able to own cars and
yeah,
presumably have homes. But like
yeah.
it's And,
So I think through all the good news, I would like to be doomer again, Jack, and
mhm,
talk about this because
yeah,
I don't think anyone is talking about this as much as they should be.
go for it.
Oh no, I mean in terms of we're currently talking about it.
Oh yeah, yeah,
Yeah, and I'm happy we're currently talking about it.
yeah. Well, and like one of the big things that like even on a national level, I've only been seeing like some kind of like token gestures towards are like the impending homeless crisis, because like right now homelessness is at like a record number, but as soon as January 1st rolls around, the protections
Yeah,
that the CDC extended until the end of the year are gone when it comes to like evictions.
yeah,
And last I checked, which was a couple months ago, I haven't been able to find any newer numbers, but there were 40 million people who haven't been able to pay their rent, and they're not going to be able to pay their like back rent at the end of the year,
yeah.
certainly.
And we
So
haven't stopped evictions nationwide.
right. And so like we're on the brink of like seeing like 13% plus of the United States population being homeless next year. And
Yeah,
that's
yeah,
something that I mean it's going to cause COVID-19 to spread like wildfire. And I looked this up the other day for reference. When we talk about homelessness during like the Great Depression,
yeah.
um it was 1% of the United States population. And 1% back then was much less than 1% right now.
1% now is like 5 million, 4 million people.
Yeah. And we're looking at 13% being
Yeah,
homeless. So we're
mm,
looking at exponentially something we've never seen before. And so not having any protections for the homeless, not having like properly funded like for housing first initiatives, not having like properly funded federal food banks, like these are things that are going to become huge problems next year if nothing is done.
and they already have. Like I've been doing my own statistics
Mm-hmm.
on the people I've been seeing since March in our ICU, and 20% of them that have died are homeless patients,
That's wild.
and that's the ones that our hospital is open to seeing.
Are the hospitals not open to seeing all homeless patients?
A lot of private hospitals have like a cap in different departments to the amount of homeless patients that they can see.
Mm-hmm. So is
Uh,
so does that include like patients who like can't pay, like who might not be homeless?
exactly. Hmm.
Okay.
Yeah. So when I say homeless, I just mean people that are like quite literally without a home,
Mm-hmm.
but are not necessarily living in the streets.
Gotcha.
You know, which even going by that definition increases that population exponentially.
Mm-hmm.
Like I've been homeless myself for a period of time, and I was just sleeping around at different people's houses, but I was still technically homeless.
Yeah. Yeah.
Um, but please correct me if that's not a valid way to like frame that definition.
I mean, I think that I would say that that's, maybe you're homeless, but you might not technically be considered like unhoused.
True, true, yeah.
So there are some weird like distinctions in
Hmm.
that category.
Hmm.
But like I have different policies where like if I was in charge of the United States of America, I feel like would fix these problems for like relatively easily. But it seems like there isn't any like political will behind doing these things.
Yeah, I mean, and it doesn't seem like there's any political will even from the Biden administration to address this.
Yeah,
And I feel like it was an amazing opportunity for him to gain goodwill by
absolutely.
by, by addressing it. But nowhere in Biden's 7 point plan does he specifically address the homeless population in America.
Right. Well, and it's because homelessness tends not to be an issue that politicians want to talk about.
Yeah,
It
yeah,
tends not to be an issue that even like city councils want to talk about. Like I've worked with people or talked with people who actually have seats on city councils, and like when people come forward with ideas or grievances to the city, like other people on the council just won't hear the actual solutions. Like we have really good evidence that like housing first solutions save
Yeah.
cities money. Like building
Yeah.
housing for homeless people and just giving them housing for free, it solves a lot of knock on problems.
Yeah.
The same with like Medicare for all, allowing people to get like preventative treatment and stuff like that. It solves a lot of problems. It reduces use of resources. It's more efficient, and it's like the good and decent thing to do. Um, but yeah, what would you like to see done?
I mean, I think the same exact things you have been saying, right? I mean, it was even so annoying that throughout this pandemic, I like tediously spent time organizing like a food bank to be created
Mm-hmm.
for homeless populations, and then I saw people in my own hospital come by when the food bank was open and take from that themselves.
That's wild.
You know, and I could be criticized, right, for not regulating it, but I think in my head, I didn't expect people during this time that I've seen so much suffering working in healthcare to be like that.
Yeah. I
Yeah.
what what has been some of the reaction to like from like people in your chat or from like the Twitch community to like the things that you talk about on a day-to-day basis?
Thankfully, you know, people have been doing a lot of outreach to like spread my name around to get me to talk to as many people as possible.
Mm-hmm.
I mean, Lucid Fox I was on with on Wednesday was someone I never thought I'd ever be able to even be on with. And I was able to be on with him. And I think the response, thankfully, has been amazing, which has kept me on and has kept me, and has, you know, updated my goal on Twitch to stay on Twitch.
Mm-hmm.
Thankfully, at the very least, within the leftist community, uh, it's been a reaction of shock initially, but then just of understanding and then active outreach. You know, like in my own community right now, um, we're creating like two apps. Uh, you know, I have run a tutoring business on the side that I've like now ported to my community to provide free tutoring
Mm-hmm.
and resume building and things like that. Like the response has been amazing.
So
You know.
you mentioned within like the leftist community, especially like what kind of reaction have you seen from like conservatives on Twitch?
Um, I mean, one of the things I do is I always keep an open mind. I answer every single question if it is perceived to be coming from good faith.
Mm-hmm.
Um, you know, unfortunately, from the conservative or right wing side of things, uh, pretty much none of those questions have come from good faith. A lot of questions that I've gotten address xenophobia, um, you know, address even the Democrats creating the virus, not even just China.
Oh yeah, the
Um,
Dr. Fauci conspiracy.
yeah, and you know, like at some point, that's even more demotivating to me, having that in my Twitch chat than seeing that in real life. You know,
Really? Why is that?
um, like in real life, I've been able to sort of have open and like comfortable discussions with people like that, and some of them I've even like, you know, got into like at least understand and start showing some concern and sympathy. uh, but I think, and I'm sure you have dealt with this too on your side of things.
Mm-hmm.
Um, when people just like completely, you know, like completely brick wall, like as soon as you answer something constructively, you just get brick walled. Um, then that's sort of, you know, that's sort of like, because I think about the fact like, okay, this is a person behind the keyboard,
Right.
right, who is so resistant to any other idea besides their own that when they do hear something that is not their idea, they get really violent.
Yeah.
And I think in my head I was like, okay, uh, I didn't expect people to be able to be like that, but
Right.
I think they're able to under the guise of anonymity.
One of the Lejin from my chat says, I think a lot of big streamers would love to have a frontline medical worker talk live. If he wants, I could poke around various other stream communities. If he wants to spread his message slash experience to more people, if you'd
Yeah,
be open to
I'd
that.
appreciate it. Yeah, throw my name around everywhere. That's fine by me.
Okay.
Yeah, I appreciate it.
Have so like you say you've found like a lot of people, you've had this conversation with a lot of people in the actual hospital.
Mhm.
How do those conversations go? And I think when I first started talking with you, like before, obviously we went live, um, you mentioned something about like there have been a lot of people who have died not believing that they have COVID.
Yeah,
Like how
there
how?
continues to be every day. Um, you know, I think because if you come from that type of background where you like are so patriotic that you have utmost trust in our federal government, and then you have the federal government saying things like this is nothing to be concerned about, it's not real or whatever.
Hmm.
And if your whole entire life background has been like I stand by and like throw my own life in front of everything the federal government says, especially someone they worship, people worship like a god almost even,
Hmm.
then you're going to get people who, despite all reason, uh, to their last dying breath, believe that way. You know.
Yeah. Uh, do you have any insight? You say you've been able to kind of convince some of these people. Do you have any insight in how to reach them? This is something I think about all the time because I feel like to an extent there is this alternate reality, and I've talked with some people who specialize in cults on my channel,
Mm-hmm.
and who kind of back up that kind of reading. Like there are these people who just live in an alternate reality where like COVID-19 isn't a problem, etc. Like that, along with like a whole host of other ideas. How do we reach into that bubble to like be like, hey, actually, no, this is a huge problem, and we need to like work together to overcome it.
So thankfully, I've had patients of that background that have survived,
Hmm.
and they have really become very helpful to me because they've left me their number to call anytime to talk to people that are on their political side of things that don't believe it
Hmm.
and share their experience. Like some of them even surviving, but having like 5+ family members die because they held
Fuck.
one barbecue, right? um, Actually, when I was on with Lucid, I made the decision since then to start making like a PSA video.
Hmm.
That's like just as harsh and impactful as like PSAs on domestic violence or drinking while driving, right?
Hmm.
Um, that can be like spread throughout YouTube, Twitch, and everything. Ideally, like we get someone famous or something, right, to even be able to be a part of it if
Yeah.
that's possible. But I'm surprised. Like, I mean, I'm surprised and not surprised that a PSA like that has never been created when it absolutely needs to be.
Yeah. I heard they took 300. Yeah, I did a story like a while ago about how they defunded the CDC by 300 million to make PSAs, and I don't think those PSAs have actually materialized yet.
Yeah. So in my head, I'm like, okay, this is, why wait for it to happen when we can use the resources of Twitch
Right.
and our communities respectively, right, to make that happen. I'm still I'm still asking for help to make that happen.
Hmm.
Anyone who is familiar with any type of video editing, uh, or like voice acting or videography or anything like that.
Yeah,
I've actually talked to a few of those patients, and they're willing to be on camera too.
that's awesome.
So I think this PSA can really come together, and I think unfortunately, like a really harsh PSA needs to be circulated.
I mean,
Yeah,
yeah, like we need to be able to reach people. Like,
yeah, like oh, Aeronaut, that's great. Yeah, hit me up on Discord. But yeah, I think unfortunately, Jack, we're like sort of at the point of we've done so much damage. There's no way to recover and negate it. That we just sort of need to hit people with the harsh reality of what I see every day.
mhm. is
You know,
is part of this fueled by the fact that like I think due to like HIPAA regulations, there isn't a lot of filming in hospitals,
well,
or some. I'm not sure exactly why that is, but
uh, in what way do you mean?
I haven't it like part of what brought like Vietnam
Mhm.
home to people was the filming of it. I haven't seen like a whole lot of like videos of like walking through ICUs to like show, look, here are the overwhelmed hospitals. Here are, you know, I haven't seen a whole lot of this kind of reporting, I guess.
And you know why, Jack?
Why is that?
Is because any hospitals who are in good faith, who want to create things like that, are afraid of pushback or repercussions from our federal
Really?
government. I mean, yeah, look what Trump has been doing while he's been president, firing basically everyone that disagrees with him.
True.
Right. So, like, what do you think will happen? I feel like if we have a hospital that's famously circulated a PSA that completely says the opposite of what he's trying to say.
Yeah.
Right. I mean, he's very actively trying to suppress Fauci
Hmm.
at every point in time that he can.
Is so this is something I've heard a lot of kind of back and forth about.
Mm.
Would this have been like would things have gotten this bad if like Hillary Clinton had won the election, or if it had happened under Obama or something like that?
Um,
I know it's hard to speculate, but
yeah. I mean, it all comes down to which politicians would actively like let a scientist and doctors, like the Surgeon General and Department of Health and whatever, take the reins.
hmm.
Um, I mean, a big part of why our response has been so bad is tr- the Trump administration has been actively dismantling any governmental federal capability to address the pandemic
Hmm.
from the context of science. Right, we had a pandemic response team that like Trump's first week in office. Right, he completely disbanded. He's completely dismantled the ability of the CDC to collect data throughout this whole entire pandemic. In addition to dismantling the staffing of the CDC, right?
Yeah, like
Like Fauci is the last doctor and scientist basically left in our federal government with any sort of political power.
yeah, fuck. Can you can you talk a little bit about one of the common whenever I talk about COVID-19 and the issues surrounding that on my channel, I sometimes I get people who come in to talk about how it's not Trump's fault, it's the state governor's fault for not properly addressing this. What makes a federal response so important?
I mean, when you're dealing with a pandemic, right, that affects the whole entire country,
Hmm.
you need a standardized level of federal direction that every state follows. Right. What we essentially did was make every state their own country
Hmm.
and allow them to do whatever the hell they wanted. Right. That's why we have such varying responses comparing Florida, right,
Hmm.
versus I mean, I don't even know any states off the top of my head that have dealt with it well.
Right. Yeah.
I mean, Florida maybe to like Pennsylvania or something. I don't know
Yeah.
that like has dealt with it okay, right? Like this is not something that needs to be decided by politicians. This needs to be decided by doctors and scientists,
Hmm.
and the doctors and scientists needed to be the ones to write out the points, right? Working with
Right.
the federal government for this federal direction, and the federal direction and the mandates to follow the federal direction needed to happen,
Yeah.
right? I mean,
Yeah, we
instead we yeah, I mean, right. Instead we had, a doctor that's the head of the pandemic response say one thing, and then the president say another thing.
and then we had a
Right?
patchwork of different responses across the country that
Yeah,
wasn't able to properly contain it. Yeah.
yeah, because the reason why you need cohesiveness, especially, was none of our states, right? Uh, None of our states decreased travel between each other
Right.
at all.
Yeah. So when one locked down, they could just go across the border into a neighboring state and keep
Yeah,
spreading it. Yeah.
yeah, and a lot of people did around the nation, right? One state locked down indoor dining, so okay, I'll just drive to the other state as indoor dining,
Right.
right? I mean, and under any other president, right? I feel like at the very least, Obama might have given the full reins to scientists and doctors that was required.
Mm-hmm.
Um, I mean, he's done. I know in the lefty side of Twitch, he's done a lot of very questionable things as well. But
Yeah.
at the very least, I feel like that would have happened.
Right. Yeah, I mean, like, no love for Obama or
Yeah,
Hillary
yeah,
Clinton from me,
yeah.
but like, I think it's irresponsible for lefties to be like, oh, it would have been the same. Like, no, there are very clear differences here.
But to be a little doomer, though,
Mm-hmm.
the fact that Trump existed in the political sphere, even regardless of who became president, if
Yep.
he was not president, has created a immense sort of cult in our country
Yeah.
of people who are resistant to science anyway. It would have been a much smaller percentage, of course,
Yeah.
under any other president, but that percentage still would have existed, and we still would have the issues we have now of figuring out how to implement vaccines to attain herd immunity.
Right.
Right? It's almost not even amazing news how we have vaccines anymore that like the FDA feels confident about.
Mm-hmm. So, is the vaccine news why you're feeling better this week?
Yeah, so I voiced a lot of criticism the past month about the vaccines in terms of how the research was done, the speediness of the research, the resistance by the companies to release the data for peer review, amongst other things that they like, you know, all of their initial publishing of the data
Mm-hmm.
were like were like press releases disguised as scientific research papers that the general public would not be able to like discern. But like a scientist and doctor would see it and like laugh, like, oh, you very conveniently hid this percentage, or oh, you very conveniently decided not to talk about blah blah blah,
Mm-hmm.
right? But organizations that I do trust, because I don't trust capitalism,
Okay.
um, like the FDA, like the Lancet Journal, or the New England Journal of Medicine. This week, they have published their peer review of the data that they have at least been able to get access to. Uh, in regards to the FDA, all 83 pages of it.
That's pretty good.
um, and reading through all of that has made me feel a lot better, and has made me question why they were initially so resistant.
Yeah, it does
I
seem pretty
I know
strange.
I think like my sort of theory is that during that time where they were sort of like having a dick measuring contest of who can get their stock up the highest.
Yeah.
Of course, then like a full release of data would not have allowed that to happen. But I mean, that speaks again to the predominant issue that capitalism and healthcare should never be two institutions that are mixed.
Yeah, I mean, we
Yeah.
can see that just from your overview of like how your own hospital is run and how you've lost like over 10% of your department to suicide and COVID-19. That's ridiculous.
Yeah,
Um,
to suicide, COVID-19, or just flat out having enough and leaving the whole field.
yeah.
You know, I know on Twitter there's been a storm of healthcare professionals leaving the whole entire field and just being like, fuck it, I'm going to dish out everything that has happened, like me.
Mm-hmm. I had a question in my chat from AZ Storm 26. Was Biden's plan different than what has already been happening, or is Biden's plan different than what's already been happening?
So I did a whole stream where I went over the whole entire 7 point plan.
Mm-hmm.
The good, okay, I'll talk about the good and the bad. The
Okay.
good is that his whole plan is basically doing the complete opposite of everything Trump has done.
Okay.
The bad is that it's like very easy, right, to run on a platform that I'm going to do everything the opposite, right?
Right.
But when you go into the thick of things, like the homeless communities, indigenous communities, communities that often fall through the cracks, as I was going over the 7 point plan, they very conveniently worded things to where it was almost as if like, okay, if those communities still fall through the cracks, well, we never explicitly said we would help those communities in our plan, right?
Okay. Great. Um.
Right, like if they just said, hey, we'll help underprivileged communities, right?
Mm-hmm.
Which sort of covers them, right?
Right.
If they don't help Native American populations, right? Or if they don't help immigrant or illegal immigrant populations, right? Right, like
Yeah.
like they're going to be like, okay, well, we said we'd cover underprivileged communities, we never said explicitly which one,
Right.
right?
Uh, when you mentioned indigenous communities, what I can imagine the answer. I don't have specifics, but what is the how are they holding up during the pandemic?
uh Fucking horrible.
Yeah.
And this was something I didn't know about until I talked with the leftist streamer Lost Sue, if you
Yeah,
know
yeah,
of
yeah.
him.
Yeah. Lost Sea's great.
um like Native American reservations in America and Canada have similarly lack of PPE as homeless communities. You know, like their healthcare programs have been decimated by the virus
Mm-hmm.
because of lack of funding, withdrawal of funding from the state governments that previously funded it.
Yeah.
Yeah, it's been a mess.
So one thing I'm seeing in chat on my end is what like the stockpiles that exist, because like you said you had a friend in the military who found like another like a stockpile of like hundreds of thousands of PPE that could have been distributed to hospitals or homeless people or indigenous communities. Uh, why hasn't that been happening? Is it just because people lost them, or is it because these communities haven't been prioritized, or is it because these people just don't care?
I mean, this PPE was for healthcare workers too. It wasn't even just for explicitly for like communities, like smaller communities that fall through the cracks. It
Right.
was supposed to be for healthcare workers. I mean, right? What ended up happening around the nation was when hospitals would order their own PPE, there were federal agents seizing them. Right? Did you
Yeah.
hear about that happening?
Yeah. There was like a weird battle between state governors and like the federal government to like get PPE.
So like hospitals that had left wing administrations that really cared for their workers, right?
Mm-hmm.
They saw an easy solution. Like, okay, our health system makes like 10, 20 million plus a year or whatever, right?
Yeah.
So if we're not getting PPE or equipment from the federal government, let's buy it externally. And then all of a sudden, as these shipments arrive, you have federal agents seizing them.
Mm-hmm. Oh. And why?
Yeah, why exactly?
Like can you do you know why, or is it like can you speculate? Because like I have nothing. I don't know why.
I don't know why either. I know it was directed by the Trump administration. I don't know if it was explicitly the president himself that made that order for that to happen. I think their reasoning, right, was like, okay, well, if we sequester it, we can more easily distribute it across the whole entire nation or whatever.
Mm-hmm.
But that never happened either.
Yeah. It seems
Right?
like it was all seized and just like left to rot.
I mean, Jack, look what happened to that data scientist recently in Florida or something. that actively throughout the whole
Oh,
time tried to speak out about the fact that she was asked explicitly by members of the federal government to fudge the numbers,
mm-hmm. I
and
think
she's
they've
fucking broken into her house and took everything.
yeah, and I think that's like the third time it's happened, something like that. Like they've done it multiple times to her.
Yeah, and that's someone who, like, out of the kindness of her heart, went public with this non-anonymously and presented all the evidence.
Yeah, it was she was reporting like COVID numbers in schools, so that parents could make like good choices about where to send their kids. Um,
Right? Like, do we live in, like, what's that book called? Like
1980,
Fahrenheit? Yeah, like night.
1984.
Yeah,
I guess I guess we do.
like, were you criticize China for so long for their methods of government when under the Trump administration the similar methods of government
Mm-hmm.
and governing have happened?
My chat Arcus Incus asks, do you know of any really good medical systems with employment models in which doctors and nurses are treated well, like an alternative to what we have right now?
Within America, yeah, a lot of the more left wing members of healthcare administrations generally lead hospitals and hospital systems that take better care of their workers and allow their workers to join unions and things like that.
So
Um,
basically, like the solution would be to let workers unionize, or like I guess having like some sort of hospital co-op where like you collectively own the hospital and can make decisions. I'm not sure how that would
I mean,
work.
in those kinds of systems that are run by left wing administrations, they don't even unionize out of but they out of the like out of need or requirement, right? They just unionize because they can, but for the most part, they feel very well taken care of by their
Mm-hmm.
healthcare systems, right? And even those, a lot of those healthcare systems, um, they try their best, right, to provide as much care as possible while circumventing as much as possible the for-profit healthcare motives.
Um,
Those it's unfortunate that, like, those are very few and far between.
right. Can you name up a couple examples so people in my chat can kind of look them up and like see
Uh,
what might be able to move, what we might be able to push for in the future?
I mean, Johns Hopkins historically has not done that very well, but very recently, Johns Hopkins healthcare system has been very much more left wing. And
Okay.
with things like left wing administrations, right? You also have a decreased amount of medical racism. You have less homophobia and transphobia in medicine, right?
So this is something I'm kind of curious about. When you say left wing administration as far as it comes to a hospital, like it seems to me like the medical consensus is that we should be addressing things in a left wing way, because like obviously the better medical outcomes is to treat patients who are trans like with respect and dignity regardless of their gender identity, or to reduce like the harm that like racial bias can have when it comes to medicine. Like these seem like no brainer things to have when you're operating a hospital.
Well, so the problem is when you want to become the top hospital that earns the most amount of money,
Mm-hmm.
you sort of become a factory, right?
How so?
Where you just see as many patients as possible while providing the highest level of care as possible to as many patients as possible that can afford it,
Mm-hmm.
right? The race to become like the best hospital in the nation or whatever is largely profit driven. And when you become profit motivated as a hospital, right, then you care less about things like making sure all patients feel like they're treated respectfully, right? Actually caring about patient feedback from their visit, right? If you're trying to get as many patients as possible, you don't care which patients don't come back,
Right.
or you don't care which patients had a bad experience, because you know at some point, right, there'll always be more and more and more patients coming,
Right. Like
right?
everyone needs the hospital eventually.
It's simply not profitable to provide ethical healthcare in our country. That's the problem. Yeah,
Is there a way to make it profitable, or is this like fundamentally why our system breaks down and we need to like shift our priority or how we do healthcare?
sure. I mean, there needs to be then higher levels of coverage, uh, you know, for procedures that are required by like the trans community, right? There needs to be a higher level of coverage for medications required by not only just the trans community but communities that generally fall through the cracks of healthcare, LGBTQIA, right?
Hmm.
There needs to be a high level of insurance coverage of immigrants or illegal immigrants or people with low healthcare literacy, right? It's sort of reversed, right? The highest level of healthcare is reserved for the people who can pay the most for it, right? And then things that are essential for certain subpopulations
Hmm.
for quality of life are not covered,
Gotcha.
right? I mean, right?
Yeah.
Like, like if health insurance, if our health insurance systems, right, paid hospitals higher premiums for treating people of lower income, right? Of course,
Yeah.
then like everything would be fucking amazing, right?
So, so one of the people in my chat says disagree. This argument is without competition. I think that this largely like there isn't competition when it comes to hospitals. Like most people don't have like a choice to which hospital they're going to get treated at.
Especially in a rural area.
Yeah.
Yeah.
So hospitals effectively have mini monopolies,
Yeah, I
right?
mean, yeah, I mean, in my area, what's been happening for the past like 5 to 10 years is my health system has been buying out all of the smaller health systems in the whole entire state, to the point where now like almost 90% of all hospitals in the state are under my healthcare system.
That's so. That's. I think this is a really weird concept for a lot of people, and I say that because I think it's a weird concept for me to wrap my head around.
Because
Like,
that is a monopoly.
right? Like the idea that hospitals like buy other hospitals to like grow and make more money. This is a weird concept because I think a lot of people imagine hospitals are more like almost non-profit like entities, but
You know,
that's not the
which
case.
which there are ones that exist, right? Like the VA, right, or other healthcare institutions that are public.
Hmm.
But in our country, the predominant healthcare institution that you have to pick from are private versus private,
Yeah.
right?
One of the people in again say AZ Storm 26. You can argue that, but there are many wealthy people that choose to go to better hospitals for better treatments. And while I would say that that's probably true, there are far, far, far more non-wealthy people in this country than there are wealthy people.
I mean, yeah.
Like I'm Doc Midnight is literally a doctor who treats these people on a daily basis. So like I
And
think I think he knows more.
I treat the wealthy people too.
Yeah.
The only distinction between a wealthy person and a poor person in my for profit healthcare system is wealthier people uh, are allowed to just request any test they want to get.
Yeah.
But for the most part, uh, within the hospital, this doesn't speak to coverage for medications or for procedures, but within the hospital, at least in terms of standard care, everyone does technically get the same standard level of care. It's just that people with more money have more leeway into like very more minute things. Well, not more minute things, because then you get into a lot of complexities in terms of uh, rejection of coverage of medications and things like that. But yeah, that's a whole other thing.
Yeah. What has your take been on like the experimental care that like Donald Trump got, for example? Apparently Rudy Giuliani is getting this as well.
So
Um,
they're
yeah.
not. I think there's a big misconception. They're not getting any level of care that you can't get at any other hospital in America that is validated and useful for the virus. What they're getting in addition like Regeneron and Remdesivir,
Hmm.
which they exclusively have more access to, has not been shown to do anything for COVID anyway.
Really?
Yeah, this has stayed true since Trump recovered from COVID, even till now.
So what? Why has it been basically just been getting pushed because it's
Money.
money for them?
Yeah, yeah, yeah. I mean, Trump plays golf with the CEO of Regeneron, right? And Remdesivir was sort of like a thing where our government was like, "Hey, it worked for Ebola, so fuck it." Right? Even despite months and months of papers proving that it doesn't work.
Hmm.
I mean, even now, my hospital gives remdesivir to people because they just simply bought such a large supply that it's a waste to not use it to them, like in their eyes.
Seems like a terrible reason to prescribe a
Yeah.
treatment.
Well, yeah. I mean, a month ago, even the WHO had enough, right, and released a whole announcement saying, like, sort of confirming, hey, we're dropping remdesivir as standard of care for the virus. It doesn't do anything, but of course we're not part of the WHO anymore. So
Yeah. What sort of effects does not being part of the WHO have? Like what?
for an epidemic, not much. For a pandemic, however, right, when the whole world relies on data from every other country,
Hmm.
it's horrible.
Yeah.
It's extremely damaging to our response. Like
I
I've had to find out how other countries are doing through social networking,
That's wild.
from like through social networking of epidemiologists and doctors from around the world. Like, thankfully we have that, but I mean, it's almost like a joke that we have to do that.
Right. How? So can you like walk us through like an average day for you?
um, yeah, I mean, every day I basically wake up at 3 a.m., spend like 30-40 minutes just waking up, and I take a cold shower and all that just so I can wake up, and then I get into work. I do we have something called sign out, where basically the doctors from the night shift sort of inform you how every patient is doing after their night shift is done,
Hmm.
just so you're like up to just so your knowledge is up to par and how everyone is doing. um and then basically we just sit in the ICU and wait for people that need to be intubated. We patients that are doing well, that we take off of ventilation, sort of immediate a lot of them immediately need to go back, and it's almost sort of like a numbers game, like, and a waiting game. And as soon as a bed opens from death or whatever, or survival, which is not that much of a case, we then triage and decide, do the like, which one of the 50 plus patients that are waiting for a bed in the ICU absolutely would benefit the most from it.
Hmm. So how many people are you treating in the ICU every day?
um my treatment team alone treats like 30 patients, but we're like a 60-person ICU divided into different treatment teams. That our ICU has like 100 something beds. We're like a huge hospital. But even then, like, our ICU had to be expanded into the OR, right, and other departments, and it's still the case where it's staying expanded
Hmm.
and at capacity. Um, I mean, otherwise, while I'm monitoring patients, I'm helping respiratory therapists do their jobs, and nurses as well due to short staffing. A lot of a doctor's life is patient charting and other paperwork as well. So I do a lot of that. I have a lot of meetings, I had a meeting today with the Department of Health, with the State Department of Health for 4+ hours. Um, and then I go home at like 6, 7 p.m. and then I stream. Um, 3 days out of the week I have night shift as well.
On top of the day
Yeah,
shift?
yeah, yeah.
How do you like how? That doesn't seem like a human could operate like that.
We have no choice. We are so short staffed that doctors are the only ones that can do the job of a nurse and a respiratory therapist,
Uh-huh.
that we've had to pull, a lot of back-to-back shifts.
I'm really sorry. What what like you suddenly become
Oh
press.
yeah.
Oh,
Also, I forgot. Sorry.
oh yeah.
A good amount of my time at work also is calling patients whose family members have died. That's like a big part of my job. um,
How often are you doing that these days?
oh, every day.
Every day?
Yeah, and a lot of it takes up a good portion of my day because sometimes the patient is actively dying. So then in like real time as they're dying, I conduct the procedures that allow for the family to grieve. Like
Hmm.
it's very extended because we want patients, right, to be able to say goodbye to their loved ones the best way possible, even if we can't have them physically there.
Right.
So we have like high quality cameras, and we have like Zoom set up. There's Zoom designed for healthcare that's HIPAA compliant and things like that. And we we facilitate people saying goodbye to their loved ones over the phone and video conferencing. And that's a good portion of my day too.
How
Um,
so how do these people say goodbye when they're like their loved ones are sedated and intubated?
a lot of them don't even recognize them as family members anymore, and almost like recoil and like disgust as like a reaction, because it's like the first time they saw their family member since they've been in the ICU.
Hmm.
You know, um, it's almost like inhumane to an extent, because if you've been in the ICU that long on a ventilator and you're like not doing well from COVID, you basically do actually look like a zombie, or you look like a monster from The Exorcist even. Like people don't recognize their family members anymore.
Yeah.
And the most we can do is like ask patients, hey, can we play their favorite music or their favorite videos for them as they're dying? And then we call time of death, right? And we do the necessary paperwork and we move on uh, to the next patient. But
How do you like how do you deal with that? Like that sounds like something that would be incredibly psychologically rough. Is it just such a normal part of your day now?
I mean, thankfully, I've like lived a life of seeing death.
I, I don't know if that's thankfully, but
Well,
yeah.
thankfully for my own sort of resilience.
Yeah.
Like when I was in undergrad, I volunteered for the fire department as well.
Hmm.
Uh, and I even did on my last year, starting from my last year of high school. And, like basically since the age of like 16ish to now, death has just been such a large part of my life that I have like ways to compartmentalize and like deal with PTSD and still be able to work and sort of like distance myself from the situation. That's all you can do, really. Right? I almost can't like recognize that the patients I'm treating are people,
Hmm.
or else it becomes like just too devastating.
Yeah. Do you like go to therapy or anything like that?
Yeah, but
Mental health
I've
care?
had to pay for it myself.
Your work doesn't cover that?
Nope.
don't you get like health insurance and stuff that would cover?
Oh, we get health insurance. It just doesn't cover.
It doesn't cover What the fuck? Why? Why? uh
It doesn't cover it because I didn't want to spend $300 a month out of my own paycheck to pay for the highest level of employee insurance.
yeah, I assume
You know,
it's they price gate that shit, I guess.
when I make 50,000 a year.
Right. Um so like you're on the front lines. What would you like to see like the government response be like from here on out? Like if you had the a magic wand to like wave, like what would you want people to be doing?
Well,
Lockdowns, mandatory
considering
masks.
considering since Biden has been elected, there has been nothing done still.
Mm-hmm.
I mean, which is not, you can't necessarily fault Biden completely because the Trump administration has been making the transition exceedingly difficult,
Right.
right? Which I'm sure you know. Um, yeah, I mean, we absolutely need mandatory mask mandates. Every single country that has released papers on mask mandates in their country
Mm-hmm.
has seen like extremely high percentage drops in COVID cases and deaths, not even from lockdowns, just from mask mandates. You know,
Yeah.
we need lockdowns. We need $2,000 plus monthly stimulus. We need to continue unemployment and even increase it, right? We can't revive the small businesses that have already died, but we need to put in money to preserve the ones that are still there.
Yeah.
We need to stop evictions, right? We need to mandate police officers, especially, to wear masks and to comply with enforcing federal directions.
Mm-hmm.
We need to have a federal direction where every state is doing a uniform thing, right?
Yeah. It seems so. And correct me if I'm wrong. The only reason that we haven't been doing this is because different people want to continue making money. That's basically been my assessment.
Yeah, but you know, I mean, what? Probably 100 economists at this point have released their own papers saying we'll earn exponentially more money and have an exponentially higher recovery of our economy if we lock down everything now and deal with the pandemic first.
Yeah. Yeah.
Right?
Short.
Nobel Prize economists have been saying this, and I'm inclined to believe them.
Yeah. I mean, like, if we really wanted to be getting out of this as fast as possible, we should be following the lead of other countries that were able to successfully contain this, but we haven't done it at all at any step of the way on this.
No, no, I continue to think we still won't.
Do
I
you?
mean, Biden. One thing that really like sort of broke my heart that Biden said, right, was like, my first 100 days of presidency or whatever, I'll ask people nicely to wear masks, right? When he previously was very strongly worded that he'll have a mask mandate
Yeah,
because we've been trying to ask people nicely since March.
and people are dying at record numbers now.
Someone pulled a gun on me for me asking them nicely to put their mask on.
Are you fucking kidding? What?
Yeah.
Can you tell this story from the beginning?
I mean, I was just in the grocery store. I was just in the grocery store and I saw this person just not even like do the thing where they wear their mask down below their chin.
Mm-hmm.
This was a couple months ago. And I was like in my scrubs and like my hospital stuff, so like people could clearly tell like who I was, and I was just like nicely asking him, hey, like I'm a healthcare professional. Uh, you know, I don't know if you've been following or hearing what the CDC or the WHO has been saying, but it's very important to wear a mask uh, during this pandemic, not only to protect like yourself, but to protect other people from your own, germs or possibility of spreading it. And then he basically just like got really defensive and started yelling and pulled out his gun, saying like, "Yeah, under what authority do you have to make me wear a mask? The virus isn't real."
What the fuck? What did you just like back off and leave? What happened here?
Well, then the like grocery store security guard stepped in, but yeah, I mean, I think there was a news story a couple of months ago, right, in Florida, because it's always in Florida.
Yep.
Uh, Someone pulled brass knuckles on someone else because they told them to wear a mask.
You weren't even telling that person to wear a mask. You were just like, "Hey, you should probably wear a mask, bud." Uh,
Well, the problem is too, right, in like grocery stores and retailers and retail work, a lot of essential workers don't even feel protected by their employers for enforcing those kinds of mandates
mm-hmm.
themselves, right? I have someone in my own community. He's a streamer called his name is Bagel Bites Official. He works in retail, and he doesn't feel comfortable asking customers to wear masks. He
Yeah.
doesn't feel protected by his employer, and he doesn't feel like he would be protected if he were attacked.
Well, yeah. When people are willing to just like pull out a gun in response to someone in scrubs coming up and be like, "Hey, you should wear a mask." I wouldn't feel safe if I was a service worker. Like I'm not gonna die for a gas station job or like yeah, I don't know.
Yeah, I mean, let's put it this way: there should be no need to have an armed security guard in a grocery store, but there is.
Yeah, what? So the security guard at this grocery store was armed.
Yeah.
That's wild. Yes, Dan Eater, Republicans are trying to get liability protections for corporations right now. Yes. Um, it's so what like
I mean, this is not the first time I've told people to ask masks and wear masks in public, and I've been accosted.
I bet not.
Like I'm not afraid to do it. I'm a big person. I'm not afraid to do that. But like, even I'm just like threatened
Right.
from just asking a simple question and explaining it.
So like what I guess I'm at this impasse of like where are you finding hope right now in all of this? Like you said you weren't doomering this week. What is your positive thinking here?
Well, my only positive thinking was okay. Finally, the Pfizer vaccines and to some extent the AstraZeneca vaccine looks promising
Okay.
and is validated by different forces that I trust in scientific research to be promising and effective.
Okay. So do you,
And that's it.
okay, that's it.
Right? I can almost guarantee we will not be able to even get enough of our country vaccinated to have herd immunity, to be honest.
Right. I mean, so many people think that vaccines are sus anyway, right?
Yeah, but our government has also, for the Pfizer vaccine at least, only purchased 6 million units.
Right.
Those 6 million units can only be used for 3 million people because it's a 2-dose vaccine.
Right.
How many? That's one. What? That's one state.
Basically, yeah.
Yeah.
Um so essentially the hope is that the vaccine will eventually over like the next year bring this to an end. What are there going
If
to be
enough
lasting
people,
consequences to this?
yeah, Yeah, there we've already started seeing lasting consequences, right? Like, I think economists right now will soon come out with a study on how many, what percentage of small business have closed nationwide since March.
Mm-hmm.
But these are unrecoverable closures.
Right.
Right? These have led to families being evicted and being homeless because they have been owners of these businesses. Right, and we can't revive we can't revive the people that have died, the patients, the essential workers, the healthcare practitioners either. We can't
Yeah.
revive 300. I mean, in my opinion, the actual data is 400,000 people at this point.
Re- really, where do you get that from?
um so another thing, I'm trying so hard to talk about this objectively.
Yeah.
uh, Another thing that Trump administration ended up doing was significantly impacting the integrity of the data collection
Yeah,
nationwide.
they had it routed through a third party company, right?
Yep. Yeah. I mean, it was still a federal department, but it was not, it was the Department of Health or something. It wasn't the CDC.
Mm-hmm.
And the CDC has been doing it for 100 years.
Okay.
um, and just anecdotally and sort of all these doctors I'm in communication with nationwide, we are all starting to do our own statistics,
Uh-huh.
and judging by like just reviewing those statistics too. In my opinion, it's way more than 300K, maybe
Gotcha.
380K right now.
How would they be scrubbing this data? I guess
Unrecoverable. Right?
unrecoverable.
We have no idea. This external department too. We have no idea how they verify data integrity, if they do at all, and they've been very sort of not secretive, but like they haven't really described or openly to the scientific community how.
Mm-hmm.
Like the CDC very explicitly describes how they verify integrity of data that they process,
Mm-hmm.
right? We have no idea for the Department of, you know, I think it's Department of Health, but don't quote me on it. But we have no idea for that department, and they have not been open about how they process the data and verify the integrity of it.
So basically, prior to that, the CDC was open about their data collection, where it was all coming
Oh, for
from.
the past 100 years, yeah.
Yeah. And so then this sudden and unexplained shift to route that information through the Department of Health
And
essentially hid the how they're collecting all this data.
uh,
And
and not only routed, but our federal government mandated all hospitals nationwide. We have to submit our data to this department.
okay,
We cannot submit it to the CDC.
gotcha. Definitely not strange and out of the norm at all.
Yeah, so we have no clue. But I mean, I can confidently say if it's not 380K, I can at least like 100% confidently say the data is underreported, not overreported.
And why can you say that?
Because nothing adds up in terms of all of us nationwide as clinicians having to do our own statistics, right? And
Gotcha.
we share it with each other, and it doesn't match up with our federal government statistics,
Gotcha.
or even some state statistics.
So kind of
Right.
relying on these informal networks that you've had to build up.
Yeah, like we're why is science and medicine now resorted to sharing data over Facebook, right?
Yeah. I So is the do you think that this is something that will be like fixed under Biden? Like, will it be rerouted back to the CDC, or is this something that like is permanently kind of scarring to the medical community
It's permanent. Um, there's been more distrust in science and medicine than ever before.
by scientists and medical
No,
practitioners?
by just the general public.
Gotcha.
You know, I mean, I'm doing my best on Twitch to recover some of that,
Hmm.
but Twitch, people who watch Twitch in and of itself is still a small percentage of the overall population,
Yeah.
right? Like, in terms of like recovering that trust, I mean, outside of like science fiction of just changing people's minds, I have no idea. I don't think it's up to, I don't think the federal government can do it. Or like even the patients that I have because of all the misinformation by actual doctors, even the patients that I have that do believe COVID is real
Hmm.
come in with a general distrust of all the healthcare practitioners because of doctors, right, and scientists that are part of things like the Barrington Declaration that have publicly said things like, "Hey, the coronavirus isn't real," blah blah blah. You have nothing to be right.
Yeah.
Like it's not just politicians, right? They've rallied doctors on their side and scientists on their side. Of course, people don't have trust in science and medicine anymore,
Yeah.
right? They
Right.
don't know who to believe.
Yeah. I mean, they're not scientists or doctors themselves. They don't have time to go through the actual like, studies and reports and conferences and all this stuff where it's typically talked about. Um,
Right?
I,
Like I'm doing the best I can on Twitch to sort of rebuild that trust through content, right, and
mhm.
through education. But we need that kind of education now nationwide, right? I think the biggest thing that needs to happen is complete transparency between healthcare systems and the general public and patients, right?
Yeah.
There needs to be like, okay, let's say we can't do anything about the for-profit healthcare system.
Hmm.
At the very least, there needs to be absolute complete transparency between healthcare systems and patients. Like healthcare systems need to be on the patient side,
Yeah. Uh,
right? That's the only way to build trust again.
is this something in your mind where like the damage has been done and this is going to be something that sticks around for like an entire generation? Is this kind of
Probably more, yeah.
is this kind of why you're on Twitch to kind of reach younger people?
Yeah. I haven't successfully. I mean, like, okay, like this is my most ideal situation
Hmm.
is like being on with someone like Pokimane or something, right? That doesn't conventionally have an audience that cares or reads or tries to understand news and politics, right?
Hmm.
And sharing emotional stories like this, right? Uh, I mean, I in my own tutoring business, most people that I work with that are customers in my tutoring business are high schoolers. I've, you know, those are the people that have actually convinced me to like been the final step to me coming on Twitch. All of them have heard me like my stories just through me getting to know them as their tutor,
Hmm.
and they've all, pretty much none of them have cared about COVID, and now they all do, and have pushed me to be on Twitch. So it can be done, and younger people, right, have been amongst the highest or higher spreaders of COVID, right?
Yeah.
And like that is my most ideal sort of scenario is to be able to speak with someone, right, that has probably like the biggest population of viewers on Twitch that conventionally doesn't, listen to political content or scientific content or anything like that.
Yeah. Yeah. Understandable. Understandable. When you're talking about like as a wider scale solution, like um, a systemic solution, is that really, does it really just come down to transparency and like better education in schools on like literacy in these matters, in these issues?
uh, Not just literacy, right? Like, I feel like one of the biggest things that I've filled the gap on being on Twitch in terms of transparency is most people, pretty much everyone outside of the hospital and the clinic, right?
Hmm.
They don't feel like they always have access to a healthcare professional that they can ask questions to,
Right.
that can clarify things, right? It's sort of like the thing where like teachers, right, like the whole thing, like teachers live in the school and they you don't have access to teachers anymore, usually if you're
Hmm.
out, if you're back at home, right? It's the same thing, right? People feel like they don't have access to healthcare professionals unless they personally know them, to clarify things outside of the hospital or outside of the clinical setting. That's one of the biggest issues, right? Because that's a significant barrier to care, because it's not really a, it's not a barrier to like uh procedural care per se, but it's a barrier to knowledge,
Hmm.
right? There's not enough time in a conventional clinic visit for for a patient to ask and have every single one of their questions clarified.
Right.
There
Yeah.
simply isn't.
And they might not know on the spot what questions they actually have until after the fact.
Exactly, right, until they do their own research or things like that. um Unfortunately, outside of me being on Twitch or doctors being forcing themselves to be accessible, it likely won't ever happen, right? We're
Hmm.
not being paid, right,
Right.
to disseminate this information. There's like no motive for most healthcare professionals to do so.
Someone in my chat says younger people spreading it as a doctor doesn't give me faith in your thoughts. In many countries in Europe, never shut down schools. I'm not entirely
Huh?
sure what that means. I
What?
guess I guess so. Why are school systems in person in many European? I think they're asking why are so many European countries open, like having in-person schooling.
I mean, they're having in-person schooling and teachers are getting sick and dying, so I don't really.
So it's a bad program essentially.
Well, it was a bad program when we started doing it here.
Yeah.
Which schools did not, for the most part, which schools did not lock down again after a week or two of being open, right?
Probably the lower income ones from what I've seen.
Yeah, but
Yeah. Hey, yeah, like the school system is like a whole other beast almost. Like there are some like hybrid school systems going on now, like half
yeah,
in school, half digital. It's very weird.
I don't even understand that mess of like why certain scores are making certain decisions. I mean, I have someone in my community that's in college right now that only recently did their school send students home for virtual schooling, and I think 10,000 plus students at that point have gotten COVID.
10,000 students in one in one like college campus.
Yeah, it's a big college, but still
It's
ten
still a
thousand.
lot of people.
Yeah.
Oh, jeez. So like I don't know like how up you are on like epidemiological history or anything like this. Have we been doing about par for the course, or is this like one of the worst responses to like an epidemic in like modern history?
The latter.
Yeah.
Yeah, I mean, because we have evidence from history of every epidemic and pandemic happening and how we addressed it. We knew how to address this pandemic. I mean, like I said, we had the people in place in our government to do so. They just got the ability to do so just got removed.
Yeah. Uh all right. I need some hopium. Where can I get some hopium in this?
Um, I guess we will have to see, right? I mean,
Yeah.
we'll have to see in January what actually happens. Right? There's like there's a distinct difference in politics, right,
Mhm.
from what is said to what is done. So we'll have to see in January, right, what actually ends up being done.
Right. Because
Uh,
I mean, like, I guess we're on that precipice, right, of 40 million people being homeless, and if that kind of comes to pass, that it's a lot of economic and political pressure that kind of demands an answer, right?
yeah, but not to mention the fact that anything that is being done by the new administration will have barriers in the Congress and the Senate and the Supreme Court. So in terms of that, we also need to see what actually is able to be done too, right?
Right.
And that scares me.
Yeah. Yeah. I guess like I don't know. I put it this way the other day. Like when you have 40 million people who are homeless, regardless of where their political affiliation is, if they have
uh,
a family to feed, if they have, you know, uh, they're starving. Um, I think that's when bricks start going through windows, right? Like this is when, the old saying goes, like, you're only every three missed meals away from a revolution.
yeah, I mean, of course, right now people are sick of being in a lockdown.
Mm-hmm.
Not that we even had a lockdown that, like, I would scientifically or clinically classify as a lockdown anyway. But, you know, of course people are sick of it, right?
Mm-hmm.
Their livelihoods are at stake and nothing's being done.
Yeah. And I guess this is maybe where I have my hope in it right now. Like, we're on the precipice of like a situation where, like, we won't be, like, our politicians won't be able to get by on like platitudes. They won't be able to get by on just saying like, oh yes, it would be nice if something could be done. Like, when you have 13% of the population unhoused and homeless,
Mhm.
and like not able to feed themselves, like this is historically when like revolutions happen. And I would prefer that be like a peaceful one. That'd be nice.
Mhm.
But I don't. I think that people are going to be really royally pissed off if they're homeless, and it's because the government sat on their ass for like an entire year and didn't do anything to help them.
Yeah, I mean, it would even be better if they actually did nothing.
Yeah.
But they didn't just do nothing, right? They they spread a significant amount of misinformation that harmed people.
Do you see this kind of like radicalizing people in the healthcare industry themselves who are on the front line? Do you see this radicalizing?
Yeah, I mean, it has, right? Like those healthcare workers that have been on Twitter publicly talking about things I talk about, but they're doing so knowing full well they'll never be able to return to healthcare ever again.
Even after the pandemic is over?
Yeah, yeah.
Do like these hospital institutions basically keep like blacklists of healthcare workers who've spoken out?
Yeah, basically. Right. The one I have tremendous respect for the healthcare workers going on Twitter talking about the same things I'm talking about
Mm-hmm.
because, like I said, they know full well they're never going back to work in healthcare ever again.
Mm-hmm.
Doesn't matter what state they move to. Yeah, it's done.
And this is why you remain anonymous, because you're essentially in a whistleblower position that could get you fired.
Yeah.
Yeah.
I even have like a slight voice changer type of thing right now, even though it's not much of a voice changer. It still basically sounds like me, but
Well, you have a wonderful voice changed voice, okay?
yeah, but I, I maybe in like 2 weeks, Jack,
Mm-hmm.
I'll be able to come back to you with like like a good feeling
Why
or,
why
or
three
a
to two
better or
weeks?
better feeling. Um, I think also, well, within the next 2 weeks, purportedly the vaccines are going to start being disseminated throughout the country,
Mm-hmm.
even though we only have like 3 million doses. I would love to see the impact that the or what impact the 3 million doses does. Like maybe if there's a good impact, right?
Mm-hmm.
Even though it's not like scientifically significant, it'll motivate more people to get the vaccine.
Okay.
Um, yeah, but scientifically I have good news this week, but politically, yeah.
Are you going to be getting the vaccine?
Uh, Whether I like it or not, I will have to.
Okay.
It's mandatory where I am.
Do you have any concerns about kind of like long-term complications of it since it had such an accelerated testing phase?
Yes, and I still do, but I am less concerned than I was a month ago when I basically said, like, don't get the vaccine right now to people.
Hmm.
um, yeah, I do feel a lot better about it. Of course, I can't, predict long term effects,
Yeah.
and we're still collecting data on it. And thankfully, the whole entire population of the UK has unintentionally volunteered to continue the trial.
I guess that's good. Yeah.
So we'll see. I do feel good about it. I would feel good about getting the vaccine. I mean, I'm itching to see what Moderna has to say once their data gets peer reviewed.
Okay.
I know I know one thing that's not as promising for the Pfizer vaccine is based on my review of the FDA's report. It doesn't seem to decrease how infectious a person is. It simply just protects them from the effects of having it.
So it essentially makes them asymptomatic?
Not, it, um, I mean, it decreases the amount of symptoms that they have, and it decreases the effect of the virus on the body.
Okay.
But you'll you would still have like an amount of virus in the body if you're infected, so you can still give it to other people. And the statistics have sort of unfortunately been showing that,
Hmm.
um, which is bad news for herd immunity
Right.
because you need the vaccine to also decrease the rate of infection. But even though AstraZeneca had a mess of a trial, upon review of their data by the Lancet, their vaccine at the very least seems to decrease to a significant amount how infectious someone is too.
Have you been hearing much about like the Cuban
Oh
vaccines? I read a
yeah,
while ago that they had a couple that were 100% effective.
no one has shit unfortunately except the top three.
Okay.
I mean, Russia, right, has said they have their own vaccine, but they've also conveniently not wanted to release the data for review
Gotcha.
or even how their vaccine is made. Yeah, which is fine if they have a secret vaccine they want to just disseminate throughout their country. Sure, whatever.
I
uh,
guess.
I mean, I even have sort of good news for that because uh, Russia's like Sputnik program has recently partnered with, I think, Pfizer or AstraZeneca, I forgot which, on vaccine dissemination and research of the Pfizer or AstraZeneca vaccines.
Oh, okay.
So at the very least, if they don't have their own, they're willing to partner with one of those two. I forgot which.
That's good.
To
Well, do you have any last words you want to share? It's been wonderful
oh,
talking with you.
oh yeah, I do have to go to bed.
Yeah, I don't want to
Oh.
I don't want to keep you up too late, like especially given that sleep is so precious for you. Uh, any last words? Anything you want to shout out? And I would love it if you came back in like several weeks, and we could touch base again on where
Oh,
things are.
I'd love to. Yeah,
That'd be
maybe.
fantastic.
Honestly, I would love to do that on like the 25th or wait. Which one is Christmas?
The 25th, I think.
That's Christmas.
Christmas Day. Wait, which one is? I feel bad. It's either the 24th or the 25th. Christmas. It's December 25th is Christmas Day. Yes. So do you want to
Okay.
do Christmas Eve or Christmas Day? It's up to you.
Which one do people actually celebrate?
It depends. Some people do Christmas Eve, other people do Christmas Day.
26th.
Do you want to do the 26th?
Yeah.
So the day after Christmas?
Yeah, that'll be really really interesting in a bad way.
Okay, yeah, I can do I can do a Saturday show. It have by oh I also meant to ask, have we seen like the tick up from Thanksgiving yet in cases,
Oh
or
yeah,
is that still in the works?
yeah. No, we've had to expand our ICU to a strip club this month.
That what? Wait,
Well,
what?
the strip club lost its business predictably. Um, so now it's an empty building that we built a ICU in.
That's I okay, I don't know how that only came up at the very end of our conversation. That's absolutely wild. Um but yeah, I would love to talk with you on the 26th.
Yeah, and actually, Jack, I don't know about your schedule tomorrow, but I hold a rotating Saturday panel
Mhm.
with the Twitch streamer Dirtbag.
Okay.
Um, it starts at 5 p.m. Eastern tomorrow. I am inviting you to join if you would like to. I don't know if that's when you'd stream.
I usually only stream on weeknights, but
Oh, got it.
I can make an exception to come on tomorrow.
Okay, awesome. Yeah, and it's not like a Dylan Burns like flinging rocks at each other debate panel. It's it's just like an educational chat.
Yeah.
Um, so like last week we had Orb Lady and Tina too, and
Or
yeah,
or play. Yeah.
um, oh, and this week we'll have one of my good friends, Cheshire Cat. She's a streamer. We'll have Tina too again, and we'd love to have you on if you want to.
Yeah, I would love to.
Okay, let me. Before I forget, I know this is like we're just talking about
So
scheduling stuff
it's
on your
all
stream.
good.
But before I forget, I'm going to invite you to our group chat then.
Okay. What time would it be?
5 p.m. Eastern,
Okay.
if you'd be able to do that.
Just so that's an hour later than me.
Oh, I don't know what time. Yeah,
I'm
you're
Central
Central.
Time.
Yeah, yeah.
Okay. Yeah, I can do that.
We don't just talk about coronavirus. We just generally shoot the shit about politics and science.
Sounds
And
like my
yeah,
my jam.
yeah, it's fun, and I'd love to have you on that.
I would be delighted.
Awesome. But yeah, until then, the only thing I'm going to shout out is that I am looking for help on creating this PSA video. I am looking for help on creating an app that my community is creating. If anyone knows how to program, we're creating an app that's basically like real reviews of healthcare professionals with
Hmm.
two-factor authentications, so hospital systems can't create fake reviews, which they do.
Okay. That, wait,
um,
fake. Wait, what? Sorry, what? Fake reviews?
if you go to any hospital system, pretty much every doctor and healthcare practitioner on their own rating system will be like a 4.8 or 4.7 or above.
Hmm.
And they will have like 400 reviews of being a 4.8 or 4.7.
That's wild. All right.
Um, but then like you'll see discrepancies on Google reviews, right? Of these 4.8, 4.7 rated doctors have like 1 star or 2 star ratings.
Hmm.
But even those sort of then get found out and disguised and buried under like another 100 or 200 4 to 5 star 4 to 5 star ratings. So like I just got fed up with it on stream one day talking about it, and I'm like, let's create a fucking app. Why not? Like that, even though it can eliminate fake reviews, it can at least very much decrease it through things like two-factor authentication.
Well, that sounds amazing.
Yeah. Yeah, otherwise I'm Doc Midnight. I am now Doc Tired. Um, Doc Tired because it's about to be midnight. And I'm sorry that I couldn't address any questions. I don't know about you, Jack, but it's typically really hard for me if I'm like really engrossed in a conversation to address like questions in chat.
Oh no, don't worry about it. Yeah.
Um, but any questions people had that I didn't address, feel free to post it in my Discord. You can find my Discord on my Twitch profile, there's a text channel for questions that you want me to answer. I typically do 2 solo streams a week. I try to stream 7 days a week, and I typically do 2 solo streams a week answering questions from Discord or react Andying to links that people want me to look at.
Is there an element of streaming for you that is kind of like blowing off steam? Is it kind of cathartic?
Oh, all of it.
Yeah.
Uh, every single one of it. Talking to other streamers, the community I built is just so amazing, and everyone's so supportive. Not just to me, but to each other. It's beautiful, like what Twitch is capable of when creators are on the platform with good intentions.
Yeah.
And I think you can probably say the same for your own community.
Yeah. um well, thank you so much for giving us like your time and your experience. I really
Yeah,
appreciate
thanks for
everything you're
having me
doing.
on your show.
Literally any time. It's been a pleasure to talk with you. And again, I'm sorry that like you're in the situation you're in.
Oh, it's okay. I mean, you know, I I am doing my job, and that's how you see it. Like, I'm doing my job, and I'm doing an extension of my job here on Twitch,
Yeah.
and I'm really happy to do it. Um, just as long as all of you out there just show as much support as you can to essential workers in your own life, I'm happy. Then I'm
Mhm.
happy. That's all we need. And if any of you learn anything from my streams, feel free to take up your own initiative and try to do the same thing I'm doing in your local communities.
Hell yeah.
Um, people who people who are questionable about COVID are a little more approachable than you might think, and they're not all right wingers.
Yeah.
Yeah.
Okay. You go get some sleep, okay?
Thank you, and yeah, thanks for your community, Jack, and thank you for having me on. It's been a
Absolutely.
pleasure. I look forward to having you on the panel tomorrow.
Heck yeah.
Uh, until then, I will be. I'll answer like one question I think on my own stream once I end the Zoom call.
Okay.
Um, and then I'll be hanging out on my Discord if anyone wants to hang out in voice chat. But otherwise, have an amazing rest of your stream, Jack.
Thank you. You too.
And I hope you have a good night, and I'll see you all tomorrow.
See ya.
See ya. Bye.
Bye.